6 medications that could increase your risk of a heart attack in today's fast-paced world. The medications we take daily help manage our health and improve our quality of life. However, what most people don't realize is that some of these medications, which seem harmless, could be silently increasing your risk of a heart attack. Heart disease is a leading cause of death globally, and it's vital to understand the hidden dangers of certain medications that could be jeopardizing your heart health without you even realizing it. If you're committed to taking proactive steps in safeguarding your health, you've come to the right place. This video will delve into 6 common medications that may inadvertently elevate your risk of cardiovascular problems. So, whether you're managing a chronic condition or simply looking to understand more about your medication, make sure you watch till the end. Before we dive into the specifics, don't forget to subscribe to Health Tips and hit the notification bell so you don't miss any of our important updates. Let's get started. 1. Hormonal contraceptives. Hormonal contraceptives have played a significant role in providing women with effective family planning options. They've granted women reproductive autonomy and control over their fertility. However, hormonal contraceptives, especially combined forms that contain both estrogen and progestin, have been associated with an increased risk of cardiovascular events, including heart attacks and strokes. This may sound surprising to some, but the risks are real and well documented. A study in Denmark involving over 2 million women revealed some alarming findings. Women who used combined hormonal contraceptives, CHCs, which include estrogen and progestin, experienced a 2-fold increase in the risk of arterial thrombotic events such as heart attacks and strokes. To put that into perspective, this meant 1 additional stroke for every 4,760 women and 1 additional heart attack for every 10,000 women annually. But it doesn't end there. Some forms of contraceptives carry even higher risks. For instance, vaginal rings, a non-oral form of hormonal contraception, showed a dramatic 3.8-fold increase in heart attack risk. The reason for these risks is linked to estrogen's impact on blood clotting factors. Estrogen increases the production of clotting factors, creating a higher chance of clot formation, which can block blood vessels and lead to heart attacks or strokes. On the other hand, progestin-only contraceptives, such as the IUD or implants, are considered to have a much lower cardiovascular risk profile. Progestin-only methods seem to present fewer risks when it comes to heart attacks and strokes. However, even these methods should be approached cautiously, especially if you have other cardiovascular risk factors, such as smoking or high blood pressure. Understanding these risks is crucial for women, especially those with pre-existing health issues. If you're using hormonal contraceptives, it might be a good idea to discuss your cardiovascular health with your doctor to explore the safest options for you. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Non-steroidal anti-inflammatory drugs, NSAIDs, are widely used to manage pain, inflammation, and fever. Medications like ibuprofen and naproxen are common examples. While these drugs are effective for treating conditions like arthritis, headaches, and muscle pain, they also come with potential heart risks, especially if used frequently or in large doses. NSAIDs work by blocking enzymes in the body called COX-1 and COX-2. These enzymes help produce prostaglandins, which are involved in inflammation and pain. By inhibiting these enzymes, NSAIDs reduce inflammation and provide relief from pain. However, this inhibition can also disrupt the balance of blood vessel constriction and dilation, leading to increased risks of heart attacks and strokes. The U.S. Food and Drug Administration, FDA, has made it clear that the risk of heart attack or stroke can begin as early as the first few weeks of NSAID use. This risk escalates with long-term use or higher doses. Research has shown that some NSAIDs, like diclofenac, have a higher cardiovascular risk compared to others. However, naproxen appears to be somewhat safer in terms of heart risk. It's essential to use NSAIDs judiciously and, if possible, opt for the lowest effective dose for the shortest period. If you have any history of cardiovascular problems, it's especially important to speak with your doctor before taking NSAIDs. Regular monitoring of blood pressure is also advised for long-term users. 3. Thiazolidinediones, TZDs. For diabetes, thiazolidinediones, such as rosiglitazone, are a class of medications commonly prescribed to individuals with type 2 diabetes to help improve insulin sensitivity. Research has shown that rosiglitazone is associated with an increased risk of heart failure, with some studies revealing a 43% higher risk of myocardial infarction, heart attack. These findings have led to a decline in the use of this medication, as the risks outweigh the benefits for many individuals, especially those with pre-existing heart conditions. The mechanism behind these risks is linked to changes in fluid retention and lipid metabolism caused by TZDs. These effects can lead to swelling, increased blood pressure, and other factors that stress the heart. In some cases, this may precipitate heart failure or other cardiovascular issues. Given these risks, doctors now prefer alternative diabetes medications that have a more favorable cardiovascular profile. If you're taking TZDs or have been prescribed rosiglitazone, it's critical to discuss the potential risks with your healthcare provider. 4. Antidepressants. Tricyclic antidepressants, TCAs, and SSRIs. Antidepressants are commonly prescribed to treat depression and anxiety disorders. While these medications can significantly improve mental health, certain types have been associated with cardiovascular side effects. Tricyclic antidepressants, TCAs, such as amitriptyline and nortriptyline, are known to affect the heart, particularly in patients with existing heart conditions. TCAs work by increasing the levels of neurotransmitters like serotonin and norepinephrine in the brain. However, they also interfere with various other bodily systems, including the cardiovascular system. TCAs can cause orthostatic hypotension, a sudden drop in blood pressure when standing, arrhythmias, irregular heartbeats, and tachycardia, elevated heart rate. These side effects can be particularly dangerous for individuals with a history of heart disease. Selective serotonin reuptake inhibitors, SSRIs, such as fluoxetine and sertraline, are often preferred over TCAs due to their more favorable side effect profile. However, even SSRIs can cause dose-dependent heart issues, including QT interval prolongation, which may lead to a dangerous arrhythmia known as torsades de pointes. If you're taking an antidepressant, especially a TCA or SSRI, it's important to work with your doctor to monitor your cardiovascular health, particularly if you have any pre-existing heart conditions. In some cases, alternative antidepressant medications or therapies may be recommended to minimize cardiovascular risks. 5. Pseudoephedrine, decongestants. Pseudoephedrine is a common decongestant found in over-the-counter cold and allergy medications. It's effective in reducing nasal congestion, but it can also have significant cardiovascular effects, especially for individuals with heart disease. Pseudoephedrine works by stimulating alpha-adrenergic receptors, leading to the constriction of blood vessels in the nasal passages. However, this vasoconstriction is not limited to the nasal area, it affects the entire body. For people with high blood pressure or other heart conditions, pseudoephedrine can raise blood pressure and increase heart rate, potentially triggering a heart attack or stroke. The vasoconstrictive properties of this drug can be particularly dangerous when combined with other medications that affect heart rhythm or blood pressure. If you have hypertension or any cardiovascular issues, it's crucial to avoid medications containing pseudoephedrine or consult your doctor before using them. There are alternative treatments for congestion that pose less risk to your heart health. 6. Corticosteroids, prednisone. Corticosteroids, such as prednisone, are used to treat conditions like asthma, arthritis, and autoimmune disorders by reducing inflammation. While these drugs are highly effective in managing inflammation and immune responses, they can also cause several cardiovascular problems over time. Long-term use of corticosteroids has been associated with high blood pressure, fluid retention, and an increased risk of heart failure. These medications can also contribute to the development of type 2 diabetes, which further elevates cardiovascular risk. Prednisone and other corticosteroids can interfere with lipid metabolism, leading to higher cholesterol levels and an increased risk of arterial plaque buildup, which can contribute to heart disease. If you're taking corticosteroids for a chronic condition, it's essential to work closely with your doctor to manage your cardiovascular health. Regular monitoring of blood pressure, cholesterol levels, and heart function is necessary to reduce the risk of heart complications. The medications we take to manage our health are vital tools for living a healthier life, but they can sometimes carry hidden risks. Understanding the potential cardiovascular side effects of commonly used drugs is crucial for making informed decisions about your health.